Proofs of Fabunan antiviral injection effectivity based on U.S.-approved patents. Trending online as a Filipino-made and have had an almost 30 years experience in treating viral diseases. The Fabunan antiviral injection has been developed over time to cater specific medical needs of the people. The promotion and government support for this cure is vital if we are going to address government's concern for its people's health. Here are some of the facts about the Fabunan antiviral injection. 1. Origin of Fabunan antiviral injection. The Fabunan antiviral injection is owned and patented by Dr. Ruben G. Fabunan. He owns the patent, which is under the Phil-Amtech, Inc., a Filipino-owned biotechnology company incorporated in the state of Nevada in Los Angeles, California. The chairman and inventor is Dr. Ruben Fabunan, and Dr. Willie Fabunan serves as the director of the company. 2. FAI first recorded case and first patent snakebite cure. The Fabunan antiviral injection has its first name Cobranin F injection envenomation antidote. The Cobranin F injection envenomation antidote is patented in U.S. with the patent number US 0054929001A, which was filed on August 16, 1994 and approved on February 20, 1996. Mr. Santiago Reguindon of Linisan, San Marcelino, Zambales, Philippines was under medical treatment in San Marcelino Emergency Hospital by Dr. Ruben G. Fabunan due to snakebite injury from September 19, 1975 to September 21, 1975. At that time, there had been first aid treatment of incision and suction at the bitten area and tourniquet is applied. However, his condition deteriorated progressively. Since commercial antivenoms were not readily available at the rural hospital, Mr. Fabunan conducted a single-blind trial experiment. In a single-blind study, the participants in the clinical trial do not know if they are receiving the placebo or the real treatment to prevent participants from altering their behavior to conform to what they think the researchers expect. Upon the application of the study, Dr. Fabunan conducted a physical examination to the patient. The physical examination revealed unstable vital signs with blood pressure at 130/100ths, temperature at 36.6 degrees C, and a weak, irregular pulse. 2 fang marks with oozing dark bluish blood at the dorsal aspect of the right hand with progressive edema of that extremity. Systemic manifestations of moderate to severe envenomation included blurred vision, apprehension, slurred speech, dysphagia, profuse sweating, excessive whitish sticky sputum, discoloration of the skin, acute respiratory distress and lethargy. The injection was given with great care and confidence in a single dose as previously prescribed. About 2 to 5 minutes after completion of the intravenous route, drug-related adverse effects were noted like transient apprehension, confusion, tachycardia, sweating, complaint of thirst and fatigue with gradual response within an hour to progressive recovery. This is a documented account of the experimental administration and not a commercial offering of the treatment. 3. FAI second patent application dengue, HIV, AIDS, and influenza cure. From Cobranin F injection envenomation antidote, it is developed to injection viral treatment. The injection viral treatment is patented in U.S. with the patent number US 0061720553B1, which was filed on September 13, 1999 and approved on January 9, 2001. Case number 1, Dengue Fever. E.S., a 55-year-old female from Nagbunga, San Marcelino Zambales, Philippines, consulted and treated by the Fabunan Medical Clinic on August 15, 1996 as an outpatient. She had the following complaints: fever of 3 days duration, maculopapular rash on her chest, lack of appetite and frequent bouts of vomiting. A tourniquet test was positive for dengue fever and laboratory testing showed a decreased platelet count. She was treated with intramuscular Dengevir Fabunan injection for adult dosage to make a total volume of 2 ml of injectable solution administered twice daily at a 2-hour interval and coupled with oral rehydration solution. The above symptoms gradually disappeared during a 5-day course of treatment and the patient fully recovered and was discharged from the clinic. Case number 2, Dengue Fever. KP, 9 months old, a female, infant child, from San Marcelino, Zambales, Philippines was accompanied by her mother for consultation at the Fabunan Medical Clinic on September 22, 1996 due to intermittent fever T=38 degrees Celsius, with skin rashes, itchiness, and loss of appetite. Tourniquet test was positive with presence of petechial hemorrhage indicative of dengue fever. The patient was treated with intramuscular Dengue Fever Fabunan injection for child dosage to make a total volume of 1 ml of injectable solution administered twice daily at more than a 2-hour interval for 3 days and coupled with supplemental oral rehydration solution. The patient had an improved appetite, all other signs and symptoms gradually disappeared, and on the third day as an outpatient, the patient was discharged from the clinic fully recovered. Case number 3, severe hemorrhagic dengue fever per a record at Jose B. Lingad Memorial Hospital, JBLMH. GDG, a 13-year-old, male, Jehovah's Witness, residing at San Fernando, Pampanga, Philippines, was admitted to JBLMH at Pampanga on February 17, 1999 due to a history of 3-day high-grade fever, anorexia associated with epistaxis, nose bleeding. Prior to hospitalization, medical consultation was done on an outpatient basis where he was sent home with cephalexin, an oral antibiotic. Patient had several bouts of vomiting and loose bowel movements (LBM), so he was eventually admitted to the hospital. On physical examination, he was weak, slightly sunken eyeballs, dry lips and dry skin with vital signs as follows: blood pressure 90/60, temperature 37.2 C, heart rate 108 beats per minute, weight 69 pounds. Tourniquet test was negative. The patient was managed as a case of dengue hemorrhagic fever with moderate dehydration. He was placed on nothing per orum (NPO), a nasogastric tube (NGT) was inserted, intravenous (IV) fluids were given along with paracetamol as well as ranitidine as medications. On February 21, 1999, the patient's parent requested that the hospital discharge the patient against hospital advice, and the parent sought assistance from the Fabunan Medical Clinic (FMC) in Zambales, Philippines. He was non-ambulatory, dehydrated, very weak, apprehensive with 2 IV lines, one with dopamine drip and the other NGT. The patient was given 2 adult doses of Dengue Fever Fabunan injection, 2 cc by intramuscular route at an hour-and-a-half interval. At that time, the patient voided twice. 3 hours after the first injection, the patient was seated and was given solid food and sipped some oral fluid solution. For the next 48 hours, he recovered dramatically with better appetite and minimal symptoms. The parents were very happy after seeing the speedy recovery of their son within 3 days of Dengue Fever Fabunan injection. The patient was discharged from the care of the clinic on February 24, 1999 fully recovered and cured. 10 days after discharge, the patient and his parent came to visit the doctors of FMC just to thank them again for his life. Case number 4, dengue fever. This is the case of a 9-year-old boy, JAA, from Subic, Zambales, Philippines, who was first admitted at a hospital in Zambales and was diagnosed with dengue fever. A laboratory revealed a decreasing platelet count. Seeking additional medical advice, his parents sought consultation at the Fabunan Medical Clinic in San Marcelino, Zambales, Philippines on July 16, 1998. Patient was given the Dengue Fever Fabunan injection, a child's dosage, 1 cc by intramuscular route twice a day at a 2-hour interval for 3 days with supplemental oral rehydration fluid solution as needed. The above signs and symptoms gradually disappeared after the 3rd day of treatment and he was discharged from the clinic as cured. Case number 5, viral influenza. This is the case of a 66-year-old male, SDC, married and retired of San Marcelino, Zambales, Philippines, who came for a consultation as an outpatient at the Fabunan Medical Clinic on May 10, 1999. He presented the following complaints: high-grade fever, temperature was 40 C, chills, body malaise, loss of appetite, severe headaches, redness of both eyes, muscle and joint pains of 2 days duration. Due to his illness, he lay in bed all day. He was diagnosed with viral influenza and was given 1 adult dose of a Influenza Fabunan injection to make a total volume of 2 ml of injectable solution administered by intramuscular route followed by another dose after a 2-hour interval. Several minutes later, he perspired profusely and went to the restroom repeatedly. He was sent home and then he came back the following morning for a checkup. He had a better appetite, rested well in the evening and felt better without any of the above symptoms. He was eventually discharged fully recovered from the care of the clinic. Case number 6, AIDS. ESB, a 47-year-old female, a clinic receptionist residing in Metro Manila, Philippines was diagnosed as HIV positive in February 1996 at an accredited medical research center. As an HIV case, she was provided with a supply of a triple drug therapy, AZT 6 capsules, Hivid 6 tablets, and Sequinavir 9 capsules. The patient was able to take medication from November 1997 to November 1998 and she experienced gastric discomfort, occasional vomiting, loss of appetite, constipation, insomnia, depression and skin discoloration. She was discharged with the following diagnoses: acute bronchitis, non-specific dermatitis and HIV infection. As related by the patient, she was an ex-overseas contract worker in Hong Kong for 7 years. In 1989, she was diagnosed with severe anemia and received a transfusion of 6 pints of blood. She was also separated from her Filipino husband since 1985 and had experienced foreign multiple sex partners. After November 1998, up to the time of consultation in May 1999, she was not taking any medicine for HIV/AIDS due to lack of funds. She voluntarily submitted herself for treatment after an informed consent at the Fabunan Medical Clinic in San Marcelino, Zambales, Philippines. As a compassionate clinical study of Chimpavir Fabunan injection to make a total volume of 2 ml of injectable solution administered by intramuscular route, this antiviral drug compilation is based on the current usage of Dengue Fabunan injection as an antiviral treatment and/or cure for dengue fever virus. The patient was administered with the Chimpavir Fabunan injection, 2 cc by intramuscular twice daily at a 2-hour interval for 9 days ending on May 17, 1999. Day by day, the patient noticed no side effects and she felt better in her daily injections. She stated that all her signs and symptoms were gone. She had an improved appetite, did not complain of fatigue, and was well rested. She no longer had headaches, vomited or suffered from depression. She had good skin turgor, gained weight and now appears in high spirits. On May 18, 1999, her test results were as follows: ELISA test HIV-I, HIV-2 reactive. In June 1999, patient was given Chimpavir Fabunan injection every week, twice daily at a 2-hour interval with no apparent complaints. In July 1999, patient was given the Chimpavir Fabunan injection every 10 days, twice daily at a 2-hour interval with no apparent complaints. A maintenance dose of Chimpavir Fabunan injection is given every 10 days, twice daily at a 2-hour interval, then repeat CD4 count every end of the month. Dosage may be adjusted depending on the CD4 count and patient response to treatment. It should be noted that the names Chimpavir Fabunan injection, Dengue Fabunan injection and Influenza Fabunan injection represent trademarks for the compilations of the present invention. Chimpavir Fabunan injection is an alternative treatment for HIV/AIDS. It may not kill the human immunodeficiency virus, HIV, but may slow down the development of AIDS and other opportunistic or life-threatening infections. It may restore CD4, CD8 and CD3 lymphocytes number and function, therefore prolonging and improving the quality of a patient's life. 4. FAI test on COVID-19 patient. A man from Manila apparently have the symptoms of COVID-19 pandemic and a pneumonia on his right lungs. So, they gave him a COVID-19 test in a medical center Manila. His brother, who is a client of the Fabunan Medical Clinic, contacted Dr. Fabunan and told him if they can use the FAI to treat his brother. Dr. Fabunan advised them to request if they can go home, have a self-quarantine at their home while waiting for the result and call him if they were already at home. With their consent, Dr. Fabunan gave him a dosage. After 24 hours of self-treatment, the man felt well and he declared clinical improvement. After almost 7 days, they got the test and he was COVID-19 positive at the time when he was first tested. The man received a call from his physician in Manila and he was shocked because of the tone of the man seems very well. 5. Dengue and HIV treatment comparison on FAI treatment. Hospital treatment. Both of FAI treatment and hospital treatment conducts consultation, examination and laboratory works. For dengue treatment, the FAI gives a series of 2 injections with a 15-minute interval per day for 3 days, while on hospital treatment gives a series of indefinite lab work. For HIV treatment, the FAI gives a series of injection for a minimum of 1 year for full treatment, while on hospital treatment gives a lifetime intake of various oral and injectable drugs. The FAI offers no IVs, no transfusions, and no confinement, while on hospital treatment IVs were conducted, blood transfusions, and agonizing confinements. The cost of FAI is between PHP 3,000 to 5,000 and the patient is functional in an hour and fully recovered in 3 days. While for hospital treatments, the cost ranges from PHP 20K 100K above depending on the length of stay in the hospital and other services. Conclusion. The FAI is a Filipino-developed cure. It has proven medical development according to the approval of their patents. However, it is only limited on proven recorded cases on cobra bite, dengue, HIV, AIDS and influenza. According to Dr. Willie Fabunan, FAI was administered to a COVID-19 patient and has improved medical treatment. The invention is said to be effective in snakebites, HIV, dengue, influenza and even the COVID-19, which is cost-effective and more efficient than hospital treatments. Disclaimer: this video is not directly related to Dr. Ruben and Willie Fabunan. It is only produced to share related information about the said antiviral injection. If you have other idea about this video, just send your comment below. Thank you for watching. If you are new to this channel, please press the subscribe button and notification bell for more informative and entertaining videos like this. If you are already our subscriber, please comment topics for our next video and you will get a free shout out. Here are our video suggestions for you.